Do you trust your doctors? You don't think they'd ever use you as a guinea pig or withhold treatment for a life-threatening disease just for science. Do you?
Hell yeah.
It turns out in the US, trust in medicine varies significantly by race. African Americans are more likely than white Americans to be suspicious of doctors.
Second opinion, please.
About 50% believe conspiracy theories about HIV, and they have good reason to be suspicious. But studies show that mistrust of medicine can be bad for your health.
Walk it off, you're fine.
So how do we draw the line between being prudent and paranoid? African Americans are 3 times as likely to be diagnosed with HIV as the rest of the country. There are a lot of reasons for that.
Institutionalized system of inequality.
Access and insurance.
Stigma.
But one reason that isn't talked about much is trust.
Talking with people in the community very early in the epidemic was a difficult conversation because there were rumors.
The government lied about inventing the HIV virus as a means of genocide.
They ain't cure that because ain't no money in the cure. The money's in the medicine. That's how you get paid.
These ideas might sound paranoid to some, but for many African Americans, mistrust of doctors has deep roots, and they were planted by real historical conspiracies.
The Tuskegee study took place in Tuskegee, Alabama, with African American men who had syphilis to, quote unquote, figure out the natural course of the disease.
These men were promised that they would be cared for, they would be given free medical treatment.
But they were never treated as anything but guinea pigs.
10 years after, a cure was found for syphilis, and medical treatment was withheld from these men. So it resulted not only in the men dying from syphilis, but also their wives contracting congenital syphilis. And this experiment continued for 40 years, until a whistleblower brought it to the whole attention of the public, and then the experiment was shut down.
That sounds like a prototypical conspiracy theory, this shady experiment that was put on by the government, which involved people's health and keeping important information from them. But it's absolutely true, that's documented, that happened.
When you have like your grandfather telling you about growing up in Alabama and how like, you know, the white doctors did A, B, and C, automatically in your brain, you're gonna be thinking like, I can't trust these people, you know?
It's not just an isolated incident, it's really an institutionalized system of inequality.
Henrietta Lacks. Samples being taken unbeknownst to you.
African Americans being used in dissections, unauthorized uses of their bodies.
The American Medical Association found that even after controlling for income and education, African Americans were offered subsistence services, more outdated drugs, more harsh drugs, and are offered more harsher diagnoses compared to their white counterparts. So when you talk about levels of mistrust, is it paranoia or is it self-care?
Then, less than a decade after Tuskegee, a mysterious new disease started ravaging several marginalized groups, including African Americans.
It's mysterious, it's deadly, and it's baffling medical science.
The number of AIDS cases passed the 100,000 mark.
Black people were disproportionately impacted from the very beginning.
It was perfect conspiracy fodder.
Something's not right here. What I'm saying, it was targeted.
So some psychologists talk about an idea called prudent paranoia, and this is the idea that it might be a good idea to be mildly suspicious most of the time, because people don't always have our best interests in mind. When you look at the history of institutionalized racism in the United States, it begins to make sense why African Americans might be more receptive to certain conspiracy theories.
This sort of embodied a larger level of mistrust that was happening for decades.
So I don't put anything past the American government when it comes to people of color in this country. I'm sorry.
We all experience prudent paranoia from time to time. If someone does you wrong, you watch your back. When we experience a history of conspiracy,
Well, I'm not a crook.
we begin to expect it. We become hyper-vigilant, looking out for signs that someone's trying to pull one over on us. Sometimes, prudent paranoia escalates into its dangerous cousin, conspiracy thinking. And that can have real consequences, especially when it comes to your health.
Rather than go to the doctor, we'll ask another man if they had the same symptoms we had. Like, hey man, does your heart ever just stop?
Sometimes it's hard to know where to draw the line between being prudent and being paranoid. Is the healthcare system in America racially biased? Yes. Are doctors spreading HIV on purpose or withholding a cure? The probability of that is harder to calculate. So we asked this mathematician. David Grimes wanted to answer an age-old question. How can we know if a conspiracy theory is true or not? So he researched several real conspiracies and how they unravel to try to determine the limits of conspiratorial behavior. When he crunched the numbers, some realities emerged.
The longer you want to keep something a secret for, the more difficult it is. The other thing you see is conspiracies are very, very difficult to sustain if you have a lot of people in them. Benjamin Franklin once said that 3 men can keep a secret if 2 are dead. This illustrates the whole phenomenon that the more people you involve, the quicker your conspiracies fail.
According to Dr. Grimes, the chances of a global, decades-long conspiracy to fake climate change or hide a cure for cancer are pretty much 0. And if it couldn't work for cancer, it probably wouldn't work for HIV either.
The idea of being able to sustain that many people for that long in a dangerous, unethical fiction, it just doesn't work when you put the numbers to it.
But here's the catch.
Just because you can, so you say, create an algorithm or whatever to kind of debunk things, I'm telling you, that pales to the strength of the human mind to believe whatever it wants.
That's the thing about conspiracy theories. If they're rooted in fear and mistrust, facts can't dispel them. We have to address the underlying causes of prudent paranoia that are real and legitimate.
The problem isn't the mistrust in the African American community, it's the lack of trustworthiness in the medical community.
So what's the antidote to mistrust? We can start by acknowledging the wrongs of our past and helping patients regain a sense of trust and control over their own health.
How are you?
Dr. Green's like a sister. I can ask her any question, and she can do the same with me.
You know me, I'm not gonna like push some medicines or anything like that, but make sure whatever you're gonna do is healthy for you. The care part is what's gonna get that medicine to that patient and get the patient to be the leader and feel that autonomy.
And the most important antidote? People who are trusted members of the community you serve.
If you don't have anyone present in the community who represents the community, there's no way you're gonna be a successful healthcare organization. You need to become a part of the fabric of the community, whether it's doing, flu shots at a church or, whatever vaccinations at a school. And I feel like that's where it begins with trust.
Doctors aren't the only people we have a hard time trusting in America. Our trust in government and other civic institutions is at an all-time low.
You Republicans in the House have been lying nonstop.
Democrats will defend any lawlessness.
Wherever there's mistrust, there will be conspiracy theories and consequences.
There's evidence that engaging with conspiracy theories promotes alienation. It makes people less likely to engage in pro-social behaviors, like voting. And so these are worrying effects.
Even more worrying, Americans increasingly don't trust each other. Why are we so divided? It's not what you may think. More on that in our next episode.